Hi. I'm pretty uncomfortable. I think I might be in labor. I'm having contractions about every 10 minutes.
Okay. Come follow me. We'll take some information from you.
Ideally, if you think you need to come to labor and delivery, either because you're in labor or even perhaps because you have a scheduled cesarean section, the team will know ahead of time that you're coming and will be prepared for you when you arrive on the unit. The first thing it is done is that you're greeted on labor and delivery. You often have to give some information again about who you are, why you're there. You'll be greeted by a nurse who will do an initial assessment to make sure both you and your baby are stable.
Hi, Ms. Jones.
Hi, yes.
How are you? My name is Tori. I'll be your nurse.
Nice to meet you, Tori.
Vicky, right?
Yes.
May I have a look at your name band?
Sure.
Great. And that's the correct spelling of your name?
Yes.
And your date of birth is correct?
Yes.
During your evaluation in triage, if it is determined that you are going to be admitted to the hospital, usually you'll be asked to put on a hospital gown. Often an IV will be placed and bloods will be drawn just to be prepared for any potential emergency that may occur during your labor and delivery. We always monitor both mom's vital signs as well as the fetal heart rate to ensure that both mom and baby are tolerating labor. And if you're a low-risk patient where everything is very stable, this monitoring can be intermittent, so you can be up and around and walking on the unit in order to have the most natural labor and delivery that you would like to have.
During your labor, your nurse really is your go-to person. She's the person that's going to be with you more than anybody, apart from your birth partner. Your nurse may have more than one patient, so she might not be in your room the entire time, but it's important to remember that thanks to our centralised monitoring systems, all of our nursing staff will be able to see both your vital signs and tracing of your baby's heart rate along with your uterine activity from multiple points across the unit. We try to give you continuity to have the same nurses throughout. However, apart from your nurse, you will also meet your obstetrician. It is important to remember with your obstetrician that you may not be delivered by your primary obstetrician. Sometimes one of their colleagues may deliver you, especially if they work as part of a practice.
What we've been able to build here is actually pretty unique, certainly in New York, if not in the whole country, in that 24 hours a day, 7 days a week, we have a subspecialty obstetric anesthesiologist on the labor and delivery floor. So supervising the anesthesia care, then of course some is delivered by residents and fellows, but there's a subspecialty trained attending obstetric anesthesiologist here 24 hours a day, 7 days a week. So that's part of what I've done as the chief of the division. I'm Dr. Smiley. I'm the anesthesiologist here today. I just wanted to come, Dr. Smith told me you had just arrived. I figured I'd come say hello and sort of check you in, if you will, from the anesthesia point of view, okay? Okay. You may or may not want anesthesia or pain relief for labor, but either way, we like to see everyone and at least make sure we know who's here, okay? Okay. Is that all right?
Yeah.
About 80 or 85% of the patients here in labor get pain relief from an anesthesiologist. So I guess the first answer is, well, most women do, so it wouldn't be a terrible decision to do that. But certainly some don't. They just decide not to, and you can make the decision as you go along. But I'd say most women get seen by an anesthesiologist within an hour or two of arriving on the labor and delivery suite. I'd say approximately 50% of the women who come in here in labor and delivery know or think they know that they want an epidural, and that's what they tell us, that I'm going to want pain relief in labor. And the other half are much more undecided, usually are waiting to see how the labor goes. And of them, 2/3 of them usually get an epidural at some point. We have women who come or don't decide on an epidural till they're 8 centimeters or fully dilated even, and we're able to provide pain relief for them quite well. It is very clear now that having or not having an epidural for pain relief in labor does not change the risk of a C-section or significantly speed up or slow down labor. The other issue that's related is that many women were told, and frankly many places are still told, that they need to be a certain number of centimeters dilated before they're allowed to have an epidural, because if they get an epidural too early, supposedly that will slow the labor. Again, in the last decade, many studies have been done very well that have shown that's simply not true, that a properly performed epidural, especially using moderately low doses as we use here, has no effect on labor progress no matter when it's done. A traditional epidural will take about 10-15 minutes to really kick in and relieve the labor pain. We have techniques now that can work within 2 or 3 or 4 minutes, and that work particularly well in late labor when traditional epidurals take an even longer time to work. Those usually involve injection of medication into the spinal fluid, and they're called combined spinal epidurals or just spinal anesthetics. And we do a lot of that here.
Here we go. Okay, so make sure you take some nice deep breaths. Okay, try your best to relax. Maybe I'll even put your head down slightly. Typically, the obstetrician comes in to see the expectant mom in the labor room after they've been admitted and all of the admission procedures are completed. You typically will see your provider or one of their partners when you're in the active phase of labor. Prior to that point, you may be taken care of by one of our resident physicians, who are basically our eyes and ears when you're at the hospital. After the baby is delivered, the parents will have an opportunity to spend some time with their baby. There will be an opportunity to bond and initiate breastfeeding if that's something that they care to do. There's also an opportunity for the nurse to evaluate the baby and perform some routine procedures. The baby will be weighed, we have a vitamin K injection that's administered, and also an eye ointment that's placed as routine for all deliveries. If the pediatrician is also present at the time of the delivery, they'll be the first ones to evaluate the baby in that first newborn exam. Their baby will then be transferred to the postpartum unit. This is done once the nurses determine that baby is stable and ready to go down to the postpartum unit, which is actually on a different floor from our labor and delivery unit. Once the baby is ready to be transferred to the nursery, your partner can escort the baby to the newborn nursery, which is located on a different floor. Once you're stable and ready to be transferred to the postpartum unit, you are then brought down and you'll be reunited with your baby. Make every effort to keep this period of separation between you and your baby brief.
Private rooms are allocated on a first-come, first-served basis, depending on availability at the time of your delivery. Visitors, they're only allowed 2 at a time, mainly because we're trying to be respectful to the other person who is in the room with you. Significant others are not allowed to stay over at night, as there isn't the space to accommodate that. All staff are trained to assist new moms and learn to look after their newborn. That includes breastfeeding, diaper changing, swaddling, and anything else that the mom will need to know to look after her newborn. Nurses round hourly on new moms to ensure that everything is going well for her. They will ask her about how she's feeling to ensure that her pain is being relieved, and also they'll want to know if she's bonding with baby and whether baby is feeding and suckling sufficiently. Babies are little people who have their own personalities, and so you just take the time to get to know your own newborn, and you'll have a wonderful, wonderful time.